Thank you, Chairman, for holding this hearing today and for our panel for testifying. As a Johns Hopkins trained dermatologist, I have personal experience treating skin cancer, and I'm aware of how devastating this can be for a diagnosis for patients and for their families. On a personal level, I never met my grandfather. He died of skin cancer before I was even born. We know that sun exposure is the primary cause of skin cancer. As a doctor and as a member of Congress, I continually advocate for the importance of regular sunscreen and the use of it for skin cancer prevention, and also regular skin evaluations and examinations for early detection. And despite attempts by Congress to ensure that the newest and most effective sunscreens can reach the US market, we are still far behind the rest of the world in approving innovative UV filters in sunscreens. And this has led to real public health alarms. I ask unanimous consent to submit the white paper from the Public Access to Sunscreen Coalition on the history of this issue for the record. Ms. Wiesek, can you speak to the current rates of skin cancer diagnosis in the United States and how that compares to rates in other countries?
Yes, thank you. So in 2014, which was when the Sunscreen Innovation Act passed, through 2022, there were over 700,000 new cases of skin cancer in the United States and 75,000 deaths in that same 8-year time span. Again, as I stated in my remarks earlier, the United States is responsible for about 1/3 of all skin cancer cases globally. So clearly we have an outsized, I think, problem with how we prevent skin cancer, how we message skin cancer prevention. It's a huge opportunity for us in the public health space.
And during that time period, since 1999, not one single new skin protection in a sunscreen, none approved, correct?
Correct.
And yet we have seen other approvals. We've seen the development of Opdiva, of Keytruda for the treatment of metastatic melanoma, but we're not starting at the beginning. We're not working where we should be working to the numbers that you just stated, the incredibly alarming numbers of increased skin cancers. These are troubling numbers. They're troubling numbers worldwide, but they're specifically troubling numbers here in the United States. Would you agree that this public health risk, Ms. Wiesek, warrants the inclusion of legislative provisions in a MUFA to resolve this issue?
Yes, absolutely.
Thank you. I agree with that completely. The United States is home to the world-leading medical innovation. In fact, I often talk about innovation being the cornerstone of American medicine, being the cornerstone of how I practice medicine. Unfortunately, the FDA's inaction has prevented this innovation, allowing the rest of the world to access new active sunscreen ingredients that are unavailable to Americans. Mr. DeRuiz, can you expand upon some of the barriers that are hindering the great innovation by not utilizing the clinical allies that our friends, not utilizing the clinical information our friends and allies have access to?
Well, I mean, people don't die from using sunscreen, they die from not using sunscreen, number one. And I think there's a large body of evidence worldwide indicating that the new young sunscreen filters, which have been developed over the last 10 years, are much more efficient, use less exposure. They're much more effective in reducing the harmful effects of both UVA and B. And 3, they're more sustainable in terms of environmental impact. So from that perspective, that body of data has propelled the industry globally outside of the US to develop new UV filters at a rapid pace. The technologies go beyond what used to be just synthetic filters, and now new technologies which are nowhere near being reviewed in the United States in terms of natural UV filters, filters that are biotechnology based. Nobody's investing in any of this because of the costs involved in the United States, the lack of data protection, and the fact there's no exclusivity. So you have a system, and we are very proud to be the only ingredient manufacturer to be in the system, and I can tell you that we've been in touch with FDA, and it's working.
Do you feel access to these natural filters can prevent skin cancers, can prevent deadly melanomas from occurring?
I think the science is evolving at the most rapid pace we've seen in generations, and that the technology that's now being generated from biotech innovations simply are astounding and should be considered in a new framework in terms of reviewing how these filters can be approved to augment what we have and even accelerate beyond what the rest of the world is doing in terms of technology.
Again, innovation here in America.
Yes.
It is my goal that we can work as a committee to streamline and unleash the process of developing these natural abilities to filter the harmful ultraviolet rays in order to unleash that innovation in the skin care protection ability of your industries. It is our duty to protect the American people from skin cancer. Mr. Chairman, thank you. My time has expired. I yield back.
The gentleman yields.